Want to take a deeper look into the recent spike in coronavirus cases.
We are joined now by Dr. Hassoun, infectious disease specialist at Huntsville Hospital. Thanks so much for taking time to talk to us tonight.
Oh, thank you for having me.
Dr. Hassoun, we know nearly 30% of all cases in the state came within the past 14 days. How big of a concern is this, and what do you think is causing the spike?
It is definitely concerning, and we've talked about that on multiple occasions. I think the issue of the spike is mainly related because people is not maintaining and following the guideline of physical distancing and wearing mask, following the basic rules of avoiding the transmission. And I think that's what bringing this up. It's really still people going out, don't follow guidelines, and we unfortunately going to see more and more if there is not going to be reversal or holding on what we're doing. It's going to be a problem.
You mentioned the masks. Texas just today is putting a mask ordinance in place statewide. There's been a lot of talk of that here. Do you believe one should be in place all across Alabama?
So I can tell you, my first belief is physical distance is most important, but if you cannot maintain that, you need to do the mask. And that's very, very important. And that's what's happening. A lot of people going into closed spaces, stores, supermarkets, restaurants, hair salons, they're going into places where there's possibility of the virus all around, and they don't wear masks. They're going into a crowd, even in the outdoors, and they intermingle without a mask. That's a major, major issue. So there's going to be a way of enforcing this. I'm not sure if the governor going to push for that or the health officer, but we need to do something about that.
If we continue to see these numbers increase at this rate, is another shutdown the next logical step?
Yeah, so I can tell you, I'm not sure masking alone is going to be the solution at the moment, because what's happening, there's a very widespread infection in the community. What we're going to need to do, we're going to need to put a hold on that transmission in multiple steps. And I think the first step is probably going to need to be some sort of lockdown. And the moment we control the transmission, we implement in addition the other things as well. Because I don't see it, because we've been doing this and it reopened almost 6 weeks, 8 weeks. We've been doing the same thing and it's just not helping at all. It's just continued to rise. We need to do something about that.
Yesterday, Huntsville Hospital CEO David Spiller said there were 121 coronavirus inpatients in your hospital system. 5 of those are children, including a 4-year-old and a 4-month-old baby. He said we've never seen kids admitted so far. Why do you think we're seeing this increase in cases among the younger population?
I think part of it is now it's widespread infection, so the transmission going to happen easily among families, and we see it definitely. It's usually in family clusters, so the parent get infected, the grandparent, the kids, and then those who's more vulnerable or exposed to a lot of viral shedding, they're going to be prone to get complication and problems. So we definitely, and like what happened in New York and other areas where they had widespread infection, they've seen kids admitted, youth admitted with significant disease, very severe disease, and unfortunately some of them have died from that.
Dr. Hassoun, according to the State Health Department, the number of coronavirus hospitalizations has also increased over the past 4 days. How concerning is the increase in severity of these cases?
Yeah, so I really think part of this is how much exposure happening. And like I said, how much viral shedding happening among the community. So sometimes we call it community viral load. And that can apply to a lot of other viruses. But the more virus in the community, the higher shedding, the more exposure, the more going to be the severity, unfortunately. Because it definitely can initiate inflammation, and the more inflammation, the more damage going to happen to multiple organs, and that's why it's severe.
Let me follow up on that a little bit. Now, the number of cases continues to climb, but the death rate has actually gone down and continues to go down. What's happening there?
So I think part of this is you always can see, a lag behind of how much cases coming up and how much reported. Now, one important thing to understand, we're seeing increase in hospitalization. We're seeing increase in severity. Part of it could be we diagnosing early, so we might be able to pick and treat with what we have a little bit earlier than what we used to have in March and April. At the same time, remember, a lot of issues that happened in March and April was in those elderly population who have a lot much comorbidities. So we saw a higher mortality. But I guarantee you, if this is going to continue, we're going to see continuous increased severity, and with continuous increased severity, we're going to see death eventually.
As the number of cases increase, a big question on everyone's mind is when will we have a coronavirus vaccine? So where do we stand on that front?
Yeah, so there's a lot of, studies ongoing. What it looked like, if we're lucky, it's going to be by the end of the year. Some people talk about November. I'm not sure if this is going to happen. We need really good data, meaning is it safe to give to human beings, and is it efficacious at the same time? It doesn't need to be 100%, but it should have some efficacy. And both of these to get as a data, you're really going to need to have some time, and that's probably by the end of December.
All right. We have a lot more to discuss with Dr. Hassoun about the recent spike.
Stay with us. You're watching Way 31 News at 6.